We're going to start by, I'm going to ask Dr. Ya-Ting Chen if she will come up and take a seat on the stage. She and I are going to have a conversation, but I'm going to set the scene before we start that conversation and talk about a number of things that Merck have been involved with in relation to vaccines. So, moving us along. So it started for us, we have a roundtable program in the Digital Health Society, and we were fortunate enough to do some work with an Irish company called Open Sky and Professor Tudor Pichelak, who I'm guessing is online and listening to this, so I need to be acknowledge his work. And originally he created a desktop survey of vaccine registries in Europe and the United Kingdom. We were able to help him with contacts at various member states and registries, which created a report. And essentially what we were looking at was a virtual model of a common electronic vaccine register. And the important point and the perspectives you can see in yellow are from an individual level, a population level, a governmental level, and then finally from academia and research. But the conclusions for this, and what I really want to emphasize here, just as a backdrop to the conversation that I'm about to have, is the existence and relevance of the electronic vaccine register is crucial to a higher vaccination rate. And whether it's correlation or causation, picking up Joe's point, we can debate. But this was where Open Sky concluded. But also there was a classic need for an electronic vaccine register template in Europe, and for Europe, read the rest of the world. And the minimum common denominator was interoperability. So then I'm just going to show you quickly a heat map that Open Sky produced as part of this report. And without going into the weighted score and how it was achieved, what fascinated me from this was I sort of expected the Nordics to be green. I wasn't expecting Estonia to be green, to be red rather. And I wasn't expecting Germany and France to be in as red or as little green as there is. So it was a very interesting piece of work. And what Open Sky are now doing is carrying on the research and looking at Asia Pacific countries to do the same comparison. So looking then at what their conclusions were, it was there's clear interest in vaccine registries. There's a momentum Tudor was talking about for action, and it's time for a qualitative leap. But then turning on to our roundtable. So along with our partner, the Institute, the European Institute for Innovation through Health Data, we ran a roundtable on immunization systems, making interoperable data systems for vaccination a reality in Europe. And again, for Europe, they read the rest of the world because the work there is not necessarily unique to Europe in any way. All of the reports for the roundtables and this particular roundtable are available online on the ECHAlliance website, so I'd encourage you to go and have a look. And the process we went through was to convene multi-stakeholders, so academics, clinicians, technologists, policy and regulators, to talk about the Open Sky report and to identify some key things. So turning on very quickly to what those key things were. First of all, it was about prioritized use cases. So a vaccine record to be able to allow individuals and families to access what vaccines there are. So I'm a cyclist, inevitably crash every now and then, and I need to know when's my tetanus due. Do I need a booster? But how do I find that out? And then it's continuity of care across borders, particularly in countries where you've got a dynamic flow of employees. tracking complications and adverse events, both at an individual and population level, linking vaccine coverage to disease burden, linking outbreaks to vaccination coverage gaps, linking campaigns to vaccination uptake, and the academic and industry research, as well as comparisons about vaccine programs. These were all things that the roundtable identified as priority actions. And another way of expressing the priorities was to look at it from the perspective of persons, individuals, population level, and program specific. But I'm not going to go into any of that detail. Other priority recommendations, and for this one, the really important thing I want to emphasize is the need for multi-stakeholder engagement on a global basis. And the points in here are very much European focused, but this point is very relevant on a global basis. And then turning then finally to the most strongly endorsed success factors. So respecting and maintaining public trust in immunization systems as greater data sharing is enabled becomes key. In a European context, this was about GDPR, but actually the conversations that took place were as much about trust between the pharmaceutical industry and policy and regulator stakeholders. And what, in many of the work that we do for the ECHAlliance, we sometimes describe the lose-lose relationship between industry and governments and regulators. And actually what we need is genuine, picking up the words a number of people have been using, partnership, collaboration. We actually need people to work together to solve problems. So other success factors were very much the scope and use cases that immunization information systems should support, along with a core set of functions for such systems, and then specifically practical data-wide sharing protocols, which again, whilst it's framed in the context of Europe, this would be equally applicable anywhere in the world in order to protect privacy and reassure and build and maintain trust. So with that, I'm going to stop and have a discussion now with Ya-Ting. Sit down.
So to introduce, sorry. Yeah, it's working. Sorry, right. To introduce you. So you have over 25 years experience in the pharmaceutical industry and academic institutions. You've been engaged in various activities to optimize the evaluation of healthcare innovations. You've led teams to develop and execute value evidence. Prior to joining Merck, you were at a research facility, so Yale University. You've got, I think, 3 degrees, so we won't go into all of that. But if we can just start by the conversation, if you like, by allowing you to say something about the disease burden. And just before I do that, the one interesting thing is just a quote that I came across from The Lancet, which was, "Is any medical procedure more misunderstood or charged with anxiety than vaccination?" So we recognize that it's one of the topics that engenders a lot of anxiety amongst many stakeholder groups, but disease burden.
Thank you so much, Bleddyn, and thank you for the opportunity of the organizer to invite me and to speak to a topic that's I'm very passionate about as a public health professional, as well as someone who have seen the impact of cervical diseases and cancers impacting families and friends. So just start by talking about cervical elimination. I think that's something that we want to actually talk about in terms of the journey of how we have this ambition and the vision that WHO put out there to eliminate cervical cancer. So as many in the audience may appreciate, that public health burden of cervical cancer is substantial. It is one of the most common cancer in women. Every year, about 500,000 women are diagnosed, and about 300,000 women die from cervical cancer. It is a a disease that is disproportionately higher in Africa, in low middle income countries compared to the high income countries. And women with cervical cancer, they're young, and many of them are mothers of young children. So it is gratifying to actually to think about that cervical cancer can be eliminated, and we can reduce these medical, economic, and mostly psychosocial burden and the disruption of family around the globe. HPV is the cause, and so most cervical cancer caused by persistent infection of human papillomavirus, or HPV. HPV is a very common infection. Most men and women will have the infection sometime in their life. With the availability of highly effective HPV vaccines, the cervical cancer can be prevented. And furthermore, it's curable if the cancer is detected early through screening and also with adequate treatment. So there is these amazing and effective intervention and tools that we can use to eliminate cervical cancer. And therefore, in November 2020, WHO proposed this strategy, global strategy to eliminate cervical cancer. And the vision is a world of elimination, like there will be no cervical cancer or a very low incidence of cervical cancer as a public health problem. And in this strategy, we also, there are also some metrics proposed in terms of the threshold for incidence of cervical cancer of 4 per 100,000 women years per year as the threshold, and also 3 interim outcomes in terms of 90% of girls by age 15 are fully vaccinated by HPV vaccines. 70% of women screened by age 35 and again by age 45, and 90% of the women diagnosed are receiving appropriate treatment. And the 90-70-90 targets must be achieved by year 2030 in order for the country to be on the path to cervical cancer elimination. So these are quite ambitious goals, and that require partnership and also political wills for country to lead actions and investments, as well as global community coming together to provide sustainable and adaptable partnerships. So immunization systems, it's really foundational when we think about being able to track immunization. And just as any public health initiatives, the digital data system to be able to monitor and to provide most up-to-date information in order to target where the gaps may be, to understand how policy can help initiate, implement, and improve on the implementation, the actions, and the targets that WHO set out there, specifically when we talk about cervical cancer, elimination of screening, vaccination, and treatment. The data system is very critical. So just kind of set the stage about why it's so exciting to talk about cervical cancer elimination and the way that we can achieve that.
So that earlier on this morning, we heard about the importance of screening in the context of FH and some genetic factors. So we again come back to this importance of screening, but also tomorrow we'll be talking about women's health. And one of the beauty of being in the ECHAlliance is that we're able to actually make honest statements that lots of organizations find difficult to do. So I think we've been staggered by the amount of discrimination against women's health services around the world. And for us, this is one of the areas in which by campaigning, by having our roundtable on vaccinations, by helping MSD to actually put out more reliable information so people are better informed. They say information is king. We're able to actually then start to tackle some of this historic under treatment of women, and so that we don't have the prevalence of the infection that is there today. Mm-hmm. But I think that you started to explain to us the importance of data, and therefore the understanding that the vaccine registries exist. And we were looking at, actually, this has got to be applicable in low middle income countries as well. It's not just a problem for the Western countries. So there's a challenge, isn't there, globally, about how we reach the targets that WHO are setting. How do you think that some of the policy measures and actions that we need to see happening in some of the countries, do you have any thoughts about what that should look like?
Yeah, thank you. That's a great question. And I should start by saying that the 2030 goals were quite far from reaching there. The most recent WHO data released estimate about 17% of the girls by age 15 were vaccinated. And that's far from the 90% target that the WHO set out there to achieve by 2030. It's also important to recognize that even though we're making progress, but in the absence of accurate and complete immunization information, it would not be possible to scale up these immunization efforts for countries. Even in high-income countries, there are still gaps in terms of connectivity of information. So, for example, the physicians of different specialists or different channels of vaccination. For example, if you receive vaccination in the office, the medical office versus at the pharmacist, the pharmacy location, the data may not be linkable, and therefore we do not have the ability to get the true picture and the comprehensive picture of vaccination practice. The gaps in underserved areas, as Emerald mentioned earlier this morning, the equity, being able to provide equitable care for the population also require data. And so the importance of these comprehensive, accurate data system, I think many of the speaker already talk about, and Bleddyn, you also mentioned the recommendation from the roundtable and the report itself. So just my few thoughts to share in terms of for country to think about how to start investing and building up, improving on the immunization information system. I think first is need to act with urgency. The moment is now. The pandemic, the COVID pandemic really demonstrated to us the possibility and the importance of being able to share robust data on disease and on immunization. So we have this experience and we should build on this powerful momentum the global community created to expand to the practice of other immunization programs, and to recognize that vaccination is actually the most cost-effective public health intervention to reduce and to prevent diseases. So leverage this immunization system to allow facilitation and improvement of vaccination programs would be important. And it also requires the government and the multi-sectorial stakeholders to be able to recognize the value and to prioritize these efforts in their country. The second area, I would say, to start by understanding your baseline. Many countries have information communication technology available. So just by doing a mapping of what are these technology and where they are, how they're connected to vaccination, screening, and treatment in the case of cervical cancer elimination. It will allow stakeholders to be able to having a starting point, even though we maybe aspire to the Nordic countries where they have these really beautiful population-based registry where cradle to grave information are all collected. But that is not, it's a goal, but I think we need to start somewhere based on where countries are and just identify opportunity to be able to connect the dots. The third area I think many also touch on is the resources, sufficient resources on the human resource, as well as being able to invest in sustainable and comprehensive data systems for these information collection. These are not trivial investments in many places, but I think that global partnership and the public-private partnership to be able to bring in together the government, academic, private sectors, as well as many technology, IT, etc., will be able to allow these building of these information system. And I think the sharing of this experience would be also really important as we continue to move forward on our journey to eliminate cervical cancer.
And next year, the UN has the Summit of the Future. And would you agree that you think that this is the sort of topic that should be being discussed at the summit? And actually, more than just a policy discussion, we should be talking about what are the investments that are required? How do we create those public-private partnerships to ensure that we have implementation? Does that sound a sensible suggestion?
Absolutely. I would love to come back next year to hear about the conversation. I think it's really great that they are these policy decision maker, the government and everyone sort of holding hands together and to try to really improve public health interventions.
So thank you very much. Fascinating.